Hello and welcome to the launch of the Global Health 50/50 annual report called Boards for All. I'm James Chow, coming to you from Hong Kong. I'm the WHO Goodwill Ambassador for Sustainable Development Goals and Health, and also host of the China Current. I'm also a member of the Global Health 50/50 Advisory Council. Today and together, we're going to be exploring the findings of the 5th annual GH 50/50 report and what it tells us about who is governing global health today, who dictates global health priorities and solutions, what interests, worldviews, and percepts are these decisions based on, and so who actually is benefiting from this now? What does it mean for priority setting, knowledge generation, and effective responses when, for example, half of the board members are coming from just 2 countries? And what could that mean for people's health on every part of our shared planet if we were able to collectively demand and shape fairer, more representative decision-making spaces? To contribute to these debates, the GH 50/50 report offers all of us a close-up view of governing bodies of global health organizations. And while it finds that these bodies continue to be the epicenters of inequalities, as many leading organizations continue to show, they can also be prime spaces for meaningful transformation. So I'm really honored to be here today with our great panelists and with each of you to discuss how together we're going to push leaders, policymakers, organizations, and each and every one of ourselves to democratize and diversify global health for all. I'm delighted now to introduce our panelists for the day, and if they could give us a short wave as I do so. First and foremost, Professor Sarah Hawkes, who's the co-director of GH 50/50 and Professor of Global Public Health at the University College London. Beside her in the same window, you can see Professor Kent Buse, her co-director of GH 50/50 and director of the Healthier Societies program at the George Institute for Global Health. In the other part of your screen, you'll see our friend Alhaj Asi, who is the chair of the Kofi Annan Foundation and also co-chair of the Global Preparedness Monitoring Board, co-chair of the Lancet Commission on Gender and Global Health, and governor of the Wellcome Trust and member of the governing board of Interpeace. Joining us from Windhoek in Namibia, we are delighted to have with us Felicita Hiquam, the director of the AIDS and Rights Alliance for Southern Africa, and also serving on the boards of the SRHR Africa Trust and Sonka Gender Justice. And we also, joining us from London, have the insights and the knowledge brought to us by Fiona Haythorne, the founder and CEO of Women on Boards. So we were going to be joined today by Anuradha Gupta, as you know, the Deputy Chief Executive Officer of Gavi, the Vaccine Alliance. Anuradha was planned to be with us at the last moment due to an unforeseen circumstance. She is unable to be so, but I'm sure she would love to send all of her best wishes to us all. So here's how we're going to use our time together. It's going to be dynamic, it's going to be interactive, and we'll be coming to you even though we're separated by laptop screens or tablet screens or other mobile devices. We're going to have a first round with our panelists so you can get to know them, some of the positions they represent, and how they link those positions with what they're hearing in the GH 50/50 report. And then about halfway through our time together, we're going to ask you to turn in your questions. So please start popping in any ideas, thoughts, insights, and questions and comments into the Q&A tool on the platform you're watching us from, and I'll do my best to raise as many of these as possible. And of course, be ready to react and respond, because this year we're going to bring in a new dimension to our interactive experience, which are a number of polls that will help all of us map, engage what you're thinking as the conversation and as the findings inform us evolve. Speakers, a gentle reminder, if you see me waving, it's not to say hello, it's beginning to wrap up some of your thoughts and to bring them to full fruition so we can get that. And finally, we encourage all of you to ensure that this inclusive conversation doesn't stay in an exclusive domain. Please get out there, especially on Twitter, and share it using the hashtag GH5050. And you can also use the hashtag boards in the plural for all. So with that, let's get started with our very first poll, which is going to be coming up on your screen right now. It's going to ask you which region you're joining from. I think Sarah and Kent, as we give our audience about 30 seconds to get underway, perhaps you can tell us, I think you're both over in Cambridge, not at home, but in a special space for today. What do you want everyone to take away from this experience we have together?
It's a good question, James. And indeed, it is a special space, just to recognise that we have managed to, at last, get our own office, 50/50, as we hope to take our message even further in a more sustainable way out into the world. I think if there's one message we want to get across and get people engaged with, it is that the room is there for the claiming, that power is not just given up by the people who hold it without the rest of us making a stake and a claim on it. So this is about how we get people to claim the room to which they are entitled.
Well, let's see which rooms we are in geographically. 5% of you are where I am, which is Asia. 53% of you are in Europe. Latin America and the Caribbean has 2%, as does Middle East / North Africa. North America, 31%. Oceania, 2%, and Sub-Saharan Africa, 5%. Let's think about that, because we are talking about claiming spaces and boards for all. So it's interesting to see where we are geographically located, although we may not originally be from the areas where we currently live. May I start off by inviting Professor Sarah Hawkes back into our space, co-director of GH 50/50, to share the findings of the new report. And Sarah, perhaps you can lend your analytical skills, bring color to life, to tell us what it means.
Thank you very much, James. And I'm absolutely delighted to be joined by people from all regions of the world. And I'm hoping that even if we haven't got a representative proportion of people from around the world in the room today, that people will take an opportunity to catch up on video links afterwards as we try to get this message around the world. So what I'd like to do over the next few minutes is to present to you the findings of the 2022 report, which is our fifth report, which really took an in-depth look at three main questions. And in the next few minutes, I'm just going to talk to the first question. But the questions we asked were, who governs global health? Who is it who's actually in charge of that room, that proverbial room that we've been talking about for the past few minutes? And then across the organizations that we've been looking at, some of them now for 5 years, who's doing well? And the question of how well has their performance done over time? And Kent, who's sitting next to me, will address the second two questions. But I want to focus on the question of who is in that room, and is the room serving the people that it is supposed to be, and who's it reaching? So to answer those questions, for those of you that are not fully familiar with the Global Health 50/50 methodology, we start with a sampling frame that was established 5 years ago and has expanded somewhat over time, but it's a sampling frame of around 200 organizations working in the global health space. And those 200 organizations are drawn from a variety of subsectors in the space. So that includes the large non-governmental organizations, the private for-profit sector, the faith-based sector, the multilaterals, the bilaterals, the philanthropic funders, some research organizations, some regional organizations, about 10 different subsectors of organizations that have a range of power, representations of power and position within the global health sector, but all of them have an interest either in delivery of health policies and programs or in influencing health policies and programs. And what we do across those 200 organizations is that we analyze them annually across a range of core variables that Kent will speak to a bit more. And those core variables essentially aim to look at how well each organisation is performing with respect to its commitment to gender equality, the policies that are in place, not just for gender equality, but for other aspects of inclusion and diversity, and then what the outcomes are, who actually gets to the top of an organisation, for example. We also look at the question of how gender responsive each organisation is in delivering its own policies and programmes. That analysis is done on the basis of publicly available, transparent information. But we do contact each organisation just to make sure we contact them twice over the course of the year that we're collecting the data to make sure we've got the information correct, to validate the data. As I say, we do look at who gets to the top. And this year we looked not just at who the CEOs and the board chairs are, but we looked in detail across the board membership of organisations. And so for the demographic information that we're about to present to you, we look at that through essentially through the social media profiles. Without LinkedIn, we wouldn't have any data to present to you today, really. So this is about what information we can find out about each person in a position of decision-making power within the organisations in our sample. So just moving to the first part, the first question, we have included data from 146 of the organisations in that overall sample of 200. And the reason we've excluded 54 organisations is that their board membership is represented by people who are there to represent member states. In other words, these are people who are there because they come from a particular country. So that if you think about an organization like the World Health Organization, their board is made up of representatives of the individual member states of WHO. So we've excluded those organisations from the analysis and instead included only those organisations where board membership is essentially on the basis of the expertise, experience, and characteristics of the individuals actually represented on the board. And across those 146 organisations, we found just over 2,000 board seats held by 1,946 individuals, because what we did find was that there's a group of individuals who occupy 2, sometimes 3 board seats. Those individuals are from 128 countries. So now the next few slides are really just going to present to you some of the basic demographics of what we're able to find out about people. So just to put this into context, you know, when we started GH 5050, we were very keen, kind of, you know, on as you may imagine, if you look at our website and you look at our bylines, we were very keen to understand questions of gender and gender inequality within the global health system. But we saw gender as an entry point to understanding wider issues of diversity and inclusion across the sector. And whilst we would be really keen to be able to tell you a lot more about the wider spectrum of diversity that all of us represent, a much more intersectional view of diversity, it's actually very difficult at a global level to capture much beyond gender, nationality, age, occupation. So whilst many of us, for example, might be interested in intersectional characteristics such as class or disability or sexual orientation, or have we got people who are refugees and migrants sitting on boards, we don't find that information at a global level. And there are for many characteristics, there's a lack of agreed definitions as to what those characteristics are. And so we're only able to present to you a small snapshot of a much wider picture of inclusion and diversity. Coming back to what we can present to you, what we see on the question of gender is that across those boards, 40% of seats are held by women, but about a third of the board chair positions are held by women. And amongst those 128 nationalities, as you're probably all aware, there is a complete overrepresentation of some nationalities compared to others. And so in particular, if we look in detail at where people come from, what we see on the basis of the economic position of the country that people come from is that 3/4 of the board seats are held by people from high-income countries. And when we think about across those 146 organizations, there is a big range of the power held by each organization. If we think about resource-based power, in other words, who's actually got the money, who's putting the money into global health policies and programs. When we look at the board membership of the organizations that hold financial power, then over 80% of the 4 out of every 5 board members in those organizations are from high-income countries. 2 countries represent more than 50% of all board members, of which over 40%, 44% of the board membership is held by nationals from the United States alone. What about if we look at the low and middle income countries? We find 25%, a quarter of board seats are held by nationals from low and middle income countries. But given the vast range and spectrum of what constitutes low and middle income countries, we focused on the low income countries, and we find that only 2.5% of the seats are held by nationals from low income countries. And if we look at the interaction between gender and nationality, only 1% of board seats are held by women from low-income countries, and less than 1% of board chairs are women from low-income countries. Because, as I said at the start, we look across a range of sectors within this broad category of the global health sector, we're able to divide up the sector and by those 10 groups, look at gender and geography across those 10 groups. And I'd encourage you to look into our report where we have all of this information in detail. But just to tell you that one sector that really stands out as not doing as well as it could and should be doing is the private for-profit sector, where we see fewer board seats overall held by women. And when we look at nationals of low-income countries in this incredibly powerful sector, we don't find any board seats held by women from low-income countries in the private for-profit sector. We don't just look at outcomes, we look at policies, and I'd encourage you again to look at this slide in detail. It's on our website, tells you whether or not these organizations actually have policies in place to promote equality and diversity. And we find a real absence of strategies and policies held by boards to actually promote diversity and inclusion. Keep saying go to our website. This is what you can do on our website. We've made it interactive. You can find out the details for any organization, for any country. You can look in detail, you can follow the flowcharts yourself. And I would very much encourage you not just to look at the report, but as somebody who works with data, I'd encourage you to look at the data too. Thank you.
Professor Hawkes, thanks very much for that. I mean, it's fascinating to see that the results are not static, but really dynamic for everyone to go forth and explore and try to make sense of as we go forward. Let's hold on to that, and let's go also to Kent. But before I do, a quick call out to everybody. The Q&A feature on the platform allows you to get your voice in. We do encourage you to ask your questions, to input your ideas, your comments, and any thoughts that you may be having at this time. It will be your turn soon to ask your questions, so please put that in now. Professor Kent Buse, who is a co-director of GH 5050. I mean, we heard the findings of the report. We've heard the start findings indeed. But how is GH 5050 now going to take that information and make it count? How is it going to use those findings to actually drive and create impact? For that, I turn over to you.
James, thank you very much. And thanks to everyone who's joined us today. I want to start off, James, before I answer that question, by recalling that Global Health 5050 was set up to inform, to inspire and incite action and accountability for gender equality in global health. And the idea really, Sarah and I are both academics, was to take rigorous evidence from academia and use a variety of communication channels to shine an independent light, and I think the word independent is important, on organizations so as to foster change. And we focused on global organizations, given the role that they play in establishing norms and standards, in setting priorities or influencing the setting of priorities and directing resource flows. Early on, we took the decision not to score or rank organizations, but instead to give organizations information about how they are performing across a set of core variables, and Sarah mentioned most of those, to encourage them to learn from one another and to celebrate in their success when progress was made. And we've got publications to that effect on our website. We also have how-to guides on our website. This year, for the first time, we recognize not only the leaders, but we're also recognizing the laggards. We did this because the results of the trend analysis, which we'll show you a slide in a moment, suggests a modest improvement in the sector over 5 years. But that modest improvement is due mainly to the improvements made by organizations that were already doing relatively well. And we commend those organizations. But what the overall trends conceal is a whole swathe of organizations who perform badly and have failed to improve. About a third of organizations in the sample have made zero or very little progress on our index, our health and index gender that Sarah referred to. For example, over the past 5 years that we've been tracking a consistent cohort of organizations, 138 organizations, 58% have never had a woman CEO, and over 50% have never had a board chair. So here we name for the first time the 32 laggards in the report, if you go back a slide. And we hope that people reading our report, including funding agencies, will use the evidence to demand much needed change. Sarah spoke to our methods, and clearly we had to make some decisions around cutoff points for what constitutes poor performance and what constitutes a lack of progress. And we did give this issue significant thought, and we engaged with our advisory council on this, as well as other experts. And as academics, we've been transparent in our approach, and you can find the methods that we used in Annex 4 of the report. Now, some people might disagree with thinking, and we welcome them to engage with us as we have throughout the progress. And we welcome the reflections and suggestions of our panelists today and the audience. For example, some people might find it unfair of us to include some organizations among the laggards who have had women CEOs or chairs. And that may well be the case. But what our evidence also suggests is that having a lone woman at the top of an organization doesn't necessarily she'll be in a position to make change to the composition of the board or ensure that the adoption of good internal workplace policies or close the gender gap and so on and so forth on this huge agenda that we have in front of us. So while it's great to see these women at the top, in fact, it's necessary, it's insufficient. There's a need for fundamental systemic change, and it's that system, as Sarah said, it's the policies and so on that we're assessing in our work. So next slide, please. The findings are neither palatable nor acceptable. And we encourage you to explore this index, which is up on the screen now, which is interactive and enables you to look at individual organizations over time across our 7 variables. And it allows you to compare organizations within a sector or across sectors. But just going back to the question that you raised, James, at the beginning, and I'm going to stop now. We do realize that evidence doesn't speak for itself. It won't bring about change on its own. We hope that the naming of laggards will help provoke much needed conversations that clearly haven't been taking place in those organizations. But really, our evidence is only as powerful as you make it. We look forward to hearing from the panel and the audience about how you can and will use these findings, as well as how we can work together to move from boards for the bros to boards for all, to build a more equitable sector to deliver health justice for all. So James, I've just sort of hinted towards the claiming the room as a solution going forward, but I think we need to do it on the basis of the robust evidence that we presented. Thanks, James, and back to you.
Thanks very much to Professor Hawkes and Professor Buse. You and your team have worked on this day in, day out over the past year since the last report. Now let's open it up wider and deeper to our panelists. If I can begin with Alhaj Asi. And Asi, we heard about the many different boards which you lead or are a key part of, most notably, I would say, the chair of the board of the Kofi Annan Foundation, and of course the co-chair of the Global Preparedness Monitoring Board, which has played such a pivotal role throughout this pandemic and before this pandemic, when you launched over in New York your first report and told us that, you know, this pandemic was going to come thick and hard with serious consequences. Obviously, you know these spaces very intimately, and in your foreword to this report, you are frequently the first and only African, the first and only Black person or person from the Global South on global health boards. What are the losses and failures when there is a lack of diversity? Why should we care if there is a lack of diversity? And how does this impact the objectives and work of the organization?
Thank you very much, James, and thanks, Ken and Sarah. In your introduction, James, you use the word "our shared planet," and when I was looking at the pictures on the slide, it just showed that our shared planet is diverse. The question is, are we seeing it or not? Are we recognizing it? We are seeing on those slides that diversity is beautiful. Are we appreciating it? We are seeing also on those slides, the diversity is, what once, Nelson Mandela called, this rainbow nation in South Africa. The collective expertise, wisdom and values, will make a huge difference in whatever you undertake. So the question is not to really if there is diversity there, if there is expertise there, if it is professionalism out there. The question is, are we recognizing it? Are we seeing it? Are we valuing it? And then are we conscious about it right from the start and not at the end? And I really stress, right from the start. So let me paraphrase, here Max Frisch, who was in a very sarcastic way, talking about the anti-migrant people in Switzerland. And he said, well, our problem is that every time we call for labor force, there are people who show up. So there's a lot of wisdom in the sarcastic phrase. And I used to say, every time we call for talent, also women show up. People from the Global South show up, but are we seeing them? Are we recognizing them? Are we take them into account? Are they make them count? And in one of the slides of the report, in the introduction is this balance. And the real question is, are we getting that balance right? So I think if we do not recognize that, if we do not see that from the start, based on what I just said before, we lose. We lose on representing what our shared planet is about, and that is a great loss. We lose in expertise and perspectives, that matter. We lose to enrich ourselves, from those different perspectives, so that whatever outcomes, we may have to come up with will be an outcomes, that matters, to all, and that is rich, in essence. And that is the reason why let's not, be in a paternalistic mood to say, call on women to be on boards, because it is a favor we do to them. People from the global south to come there, as if, making them a favor, to be there. And then almost bragging about it. There is absolutely nothing to brag about. I think, if you call for talent and women show up, they deserve and they want their seat around the table. And people from the global south, and particularly women from the global south, because you have the double hat in terms of exclusion. It is not a favor from anybody, it is a seat, that you have won. And it is rather, I think, a contribution. People should be, rather grateful and thankful, than, bragging about, having that space, to put it. However, one can, make an effort, to create that space. And I think that's where leadership matters. If people, are in leadership position, it is a privilege, sometimes, because simply you happen to be in a position, when that was required, but because you have opportunities also that you were lucky, to have, or you have also encountered, people, who helped and then open doors and then give you opportunity. And well, then if you remind yourself to all of that, then you have a responsibility also to share, the same thing. You share knowledge, you share power, you share space. And when you do that, of course, you see the richness, in it. And it will not be measured in terms of what we lose, but rather in terms of what we gain. And what we gain is so much. And I think the report is pointing to that. And I'm sure that my friends, on the panel, will give us, highlights of many of the things, that we have gained, and then we can further discuss it. Thank you, and over to you back, James.
Thank you very much, Asi, for sharing your wisdom and experience, because you talk about, apart from the part about the bragging, when you couch it in a way as if you're doing someone a favor by asking them to come on, it also triggers a feeling that somehow we have to be grateful for having been given that favor. And of course, that goes far beyond so-called favors for global health, but it crosses so many areas when people are left out and they're not allowed and permitted to participate. Let's hold that thought and link it now to Felicita Hikam, who is, we mentioned earlier, is the director of the AIDS and Rights Alliance for Southern Africa and works on so many boards over the years. I mean, Felicita, when you hear the findings, when you listen to what Asi has said, and also with your own hard-earned expertise, how do you interpret what you're listening to? What kinds of obstacles have you witnessed to more diverse representation on boards? And alternatively, what factors have helped you on your own journey to real leadership? Felicita, I think we have to unmute you.
Unmute after all these years. Still, the unmute button is elusive. Thanks, James, for that question. I must admit that I'm sure, as most people on the panel, were not surprised by the findings of the report. I think the extent of which the disparity was manifesting, in which the disparity was manifesting, for me was what was surprising. I didn't expect it to be to that extent, and it's quite embarrassing for us as a global health sector. But what I'm reflecting on as I read the report, and also as I was listening to the other panelists and Sarah and Kent presenting the report findings, I just was reflecting on the fact that, the global health system is inherently unequal. And that despite the claim that we work to address inequities in health outcomes, especially in low and middle income countries, the underrepresentation of people, and particularly women from low and middle income countries in global health governance, is actually rooted in a history of inequity, colonialism, white-centeredness, capitalism, and patriarchy, which uphold the system that still privileges white men from high-income countries for positions of power in global health governance. These men hold most of the power in governments, in economies, in academia, and other sectors globally. And it is really no surprise that they would hold the power in global health governance. I want to reflect on a dialogue that we convened at Arasa that I work for, together with Matahari Consulting last year, to discuss racial diversity in global health. And we convened a group of Black and Brown global health professionals, including people from communities living with HIV, TB, or affected by TB and malaria. And the issue of imbalance in power in global health governance obviously came up. And I want to quote from one of the participants, which said, global health is inherently contradictory. We want to reduce inequities, but in practice, global health was birthed in supremacy, and it continues to be dominated by white supremacy. White men are reaping the benefits of the system. Why would they want to change it? It's their world, we are living in it. And another quote that I actually found was very pertinent to this conversation was one that actually points out one of the key obstacles. And this was something that many of the participants agreed on, was around the fact that Black and Brown people, and particularly women from low and middle income countries, don't have the social capital and the boardroom capital to be recognized in spaces that they described as white boys networks that exist within global health, within the global health architecture. And plays out also in governing boards. But I wanted to reflect on the findings of the report to draw out some of the key obstacles in my experience, which is quite sadly that the report found that 3/4 of organizations assessed did not have any published board diversity policies, and even fewer have affirmative measures in place to promote gender and geographic diversity. Thus, the disparity is enforced by our cultures, our values, the policies and programs and practices that are ingrained within our institutions. And they sadly mirror a very problematic disparity in power due to a global health system that is slanted towards whiteness, patriarchy, and capitalism. Thank you.
Thank you very much, Felicita. Let's cross over now to Fiona Haythorne, who is the founder and CEO of Women on Boards. And Fiona, your experience is so deep and vast, having sat and advised and actively patroned of different boards, not only in health, but far beyond. From your insights that are drawn from advocating for and supporting women to access board membership, what are some of the biggest obstacles that you continue to see, and what are some of the excuses that people come up with in saying that they don't have that representation that they should have?
I mean, I think one of the biggest things is we need data, and that's the great thing about this report. Here we have a data set. What gets measured gets managed, what gets managed gets monitored, and that gets done. So we've got a great starting point. I think Felicity has really called it out. To see two countries, the US and the UK, dominating these boards absolutely horrified me. What we know that makes a real difference is organisations need to look at their constitution. How do they recruit their board members? They need to do skills audits. We know diverse teams, it's not about women, it's diversity of thought in general, and we need the regulators to get involved. So I wonder how strong and who's the main regulator. We're seeing a big difference in financial services at the moment globally, and that's because the financial services has quite a heavily regulated sector. So the Financial Conduct Authority is insisting that companies are diverse, whether they're listed or not, and it's also insisting they talk about their culture and their leadership style. Who is leading this within the global health sector? It's so important. We know diverse teams reduce risk. We know women in particular, if they have cancer, for example, and they see a male doctor, they've got an increased chance of dying. And that's because they're not being listened to and they're not being heard. And the underrepresentation of low-income countries really does alarm me, because you won't get the right products and the processes and the health and the well-being that's needed in those countries. So I think it's a super data set. What I know works is advertising transparently board roles. Where are these board roles advertised? People talk about wanting diversity, but if they don't advertise the roles, we don't know there's a vacant seat. That's why my organisation advertises board roles for free, and then we help people apply for board roles. One of the things that Felicity was talking about is we need to help people step up onto the boards. And if you're a minority of any form, you have to sell your board value add better. So we need to help people sell themselves on boards. They should not be tokens. You described that yourself, James. They are beacons of light in terms of the diversity of thought and the information they can provide. So I think it's fantastic to also name these organisations, because what we do know is chief executives and chairs tend to be quite competitive. I've been following Twitter. Those that are doing well are tweeting the heck out of this at the moment. Those that aren't doing well are not. So it's very much setting targets. The report also identifies that people put culture in, they talk about it, but they don't have any process and policies to interact change. And we're seeing a big difference in the financial services sector, certainly in the UK, in Europe, where a lens is put on this sector and somebody is looking at gender pay gap reports and saying, okay, you've set a target, but how are you going to achieve that target? So change will happen, but it won't happen unless this data is produced, and it won't happen unless the management team actually make way for diverse candidates.
Well, Fiona has also, if you've noticed on the chat feature, called on each of you to tweet what you're hearing, what you're thinking on social media right now. You can use our hashtag GH5050 and hashtag Boards for All, which is, of course, the name of this annual report. Thanks very much, Fiona, for that. But please don't let any of us go away, because we're now going to turn to the questions that are becoming in thick and fast from our audience. So what I'll ask our panelists, any of our panelists, to do now is to listen hard as I read out a couple of the questions and see if any of those that you particularly want to speak to. A number of questions that have come in. First of all, there was one from Maureen Reed, just asking, how do you define a global health organization? That's been answered live. We define global as organizations that are active in at least 3 countries. But let's look further afield at some of the other questions. I think the first one came in from Claudia Shimush, who's over in Poland, in sexual and reproductive health and rights, including HIV and AIDS, for the International Federation of Medical Students Organizations. Now, Claudia says, my question is, if the data was also compared between youth and adult-led organizations, do we see changing patterns in governing in this dimension? I'll carry on reading. Please take note of what you want to respond to. Jay Goulden asks, do you consider having board members from high-income countries from the global south, such as Chile or Uruguay, as undesirable, in quotes, as having board members from high-income countries in the global north, for example, US, UK, with their 51% of all board members? Apana Pathak said he's curious about a few questions that were discontinued from 2021. Any reason? Mariana Martin says, as a Latin American woman, I can see your report translates my feelings into concrete statistics, the kind of statistics that Fiona was saying is very important, that data, and how the colonized world of global health changed little during the past years. Is the global north really willing to give up the power? And how do we ensure a meaningful participation of low and middle income countries in the global health agenda, rather than performing a northern ventriloquism and having a tokenistic position in the attempt of increasing diversity statistics? That's one heck of a question that Marina put to all of us there. Valerie Fea says, I wonder if nationality of the studied organizations combined with the country's regulation they refer to may impact the percentage of low middle income countries as chair. And someone else, not with a name to this, says, it's easy to feel powerless in the face of such a massive challenge. What can we do at an individual level? I think perhaps we could save that for the very, very end, because that question is great. That could be something that we can all take away in terms of an individual action point? Let's save that. There's a gem of a question there. There were a couple of questions, Dorothy, I haven't forgotten you. You asked a couple of questions in the other chat. I'm just going to quickly go to those. Dorothy, you asked a lot of questions, but they're great. I think you're Dr. Dorothy Shaw in British Columbia, if I'm right. You asked a couple of questions looking at board seats, for example. How do you account for nationality of origin, parenthesis birth, versus current nationality? That's a very interesting question because we're in a globalized world. And also, I think you asked another one over there, which is sitting on my head, but let's quickly go back. You did quickly ask something that we have responded to live. Can you comment on the changes in governance and structure of global health boards? In the past 3 years, I'm aware there have been several. How did this feature in your report? What time period does the 2022 report cover? The quick answer to that was, we're happy to explore this during the Q&A. Can I ask to clarify? Oh, okay. So any of these questions, who would like to go first? And if you could quickly remind us what that question addresses. Sarah, I see you scratching your nose. I think that means you're deep in thought.
It was a sign. No, I think we're going to start with Kent, who's going to answer the question about age. I can certainly answer a couple of the other methodological ones.
Whereas I can't.
No, he can't.
Thank you. And clearly we need more than 90 minutes for this, but I'm going to address Claudia's around age. And Claudia, if you look back at our 2020 report, you'll see some data in there that may discourage you, but I ask you not to be discouraged, because Fiona gave us some very, very practical tips in terms of how you can claim the room. But the data that I'm going to give you suggests that there aren't that many youth-led organizations, sadly, that are in our sample. The average age a couple of years ago, if I'm not mistaken, was for the CEO, the average was just over 60, and for the board chair, just over 65. And however, the encouraging part of the news I can give you, and it's figure 34, you can look at it, and this could be good for your advocacy, is that those organizations that had CEOs that were younger had boards that had greater gender parity. And those where the CEOs were over 65, there's basically very little gender parity on those boards. So have a look at that data, and that might be helpful in terms of your advocacy cases. But I'd also just ask you, to let us know if you think there are youth-led organizations that conform to our definition of a global health organization. We would love to include them in our sample, because I think we've got a lot to learn from them. Sarah, did you want to answer a couple of methodological ones now, or open it up to the panel for the more? Yeah, let's just, yeah.
And we are still available long after this event, so you can continue contacting Global Health 5050. Does anybody want to crisply answer some of the other points raised? Who should we go to next? Fiona?
One of the things that I think is interesting, can you hear me? I was just typing an answer. So, one of the things that are interesting is supporting candidates join boards. And I think what we need to do is not only it's taken 10 years in the UK, and when they first started talking about diversity on boards, for boards to actually really believe that those diverse boards are better. And that's because there's more than one female candidate on the board, or there's diversity, it's not dominated by one group. So I think it is encouraging people to join these boards, and slowly we'll see change coming into the boards. But understanding the role of the board, the regulators getting involved, has been absolutely crucial. So something quite probably happen, but we need people to give up power. In the UK, people are giving up power. They're being forced to, they're being shamed into it, and they're realising that term limits are very, very important. I think we need to look at, people should really be sitting on boards for more than 6 years. 9 years, you're beginning to lose your ability to actually add value.
Okay, thanks very much for that, Fiona. Asi and Felicita, what speaks to you?
Yeah, thanks. I want to build on what the great points that Fiona made, before, when she was talking about, the data and also the advertisement of vacancies, so that we know where those spaces are. Great points. But I think now, Fiona, more and more they're advertising vacancies, but you have to look at those vacancies, and it just makes me smile. Then they tell you, you will have to have had a CEO position before. You will have to have 20 years of experience, in health and then development, and then. If you add all those, how can you be, less than 65 and then have, 20 years of experience, have been a CEO before, has an experience, in board membership, etc., etc. And then on top of it, they tell you, you will need only about, 50 days, of to your time, in the year. And by the way, it is not remunerated, it is on a voluntary basis. Well, where do you look? When you then meet, the 3 points, and you're from the global south, your internet connection is not so great. You have to pay all of that out of your pocket. You don't have a, secretariat that support you. You don't have a foundation in your back, that give you money, for whatever. Of course, even the transparency in advertising and saying it is open to everybody. And at the end of the day, if we put all of that, so then we put this nice sentence: applicants from the global south, and particularly women, are highly, recommended and then requested. Well, my goodness, you don't get it, that way. Well, how on earth you will get a young person, in there? People like me in middle of 60s, happen to be the youngest, in some of the boards. So that's your definition, of youth, in board, membership. And I think, I fully agree with you. Let's advertise. And then that advertisement then help us look into what is behind, those words, that we really need to challenge, we need to address in order, to have the access, that is required. So the second very excellent point you made was about, the data that showed it, so crudely and measure it, which we were missing. But I think often what we are missing is to act on that. I think we have to really have a way to act on that. And I think we need to find, in addition to that, what is the advocacy, that needs to accompany it. And in some instances, even the activism, that has to accompany that in order to make it happen. And there is something to be done at an individual level, of course, like as Jam suggested. I will keep them for the end, to come back to.
Well, we will come back to that question at the end. Fiona, I think that you want to respond to something, and then we're going to save some of the time for Felicita.
Felicita wants to respond as well. Chief execs often don't make very good board directors because they're not very good at overseeing organisations. You've also mentioned some of the blocks, internet connections. It is understanding all of that, and then you need to put systems in processes to enable people to apply, to enable people better sell themselves, and really support. It can happen, but it doesn't happen very, very quickly. But understanding the blocks is a crucial part, and you identify quite a few of them there, and it's important to understand that. Over to Felicita.
Thanks, Fiona, and thanks, James. I think, that last point really resonates with me and my experience on the UNAIDS board as the African NGO delegate, and reflecting on the support that was provided through a communications facility, and also, some of the requirements around people living with HIV having to be, having to be preferred candidates, and people that are most affected by the health issues, really being provided space to take the lead and be part of these conversations. But I think that additional support and institutions really being willing to provide the support in identifying and making space and creating access for people from low and middle income countries, but also for women of color and women in these countries. Institutions have to physically do things. But one of the things I wanted to respond to also was this question from Mariana about, is the Global North really willing to give up the power? And I think that is such an important conversation. And I'd like to extend it to say, are white men on these boards really willing to give up the power? And maybe even put a challenge to us to say we actually do need to have a conversation. We need to convene a space where we can critically unpack that and speak directly to the white men that are in these positions of power and look at how do we bring people along? How do we support people to create and facilitate access to these spaces, but also the role that they play in kind of crowding the space and keeping that circle very small. I think what Fiona was saying for me rings so true. There's something that we have to do around forcing institutions by demanding that they put in place policies, that they review their recruitment processes, etc. But I think we also have a role to play in terms of changing the culture to one that is respectful and appreciative of diversity on these boards. And in that way, bring people along to appreciate the value of diversity on these boards. So I think we need to do, we need to work at multiple levels. While we need to demand and force people to do it at the moment, we also need to look in the long term to how do we create institutions that truly value diversity.
Thank you very much, Felicita. And as our audience can see for themselves, there are more comments and more questions coming in on the Q&A feature and also on the general chat. I think it's time for us to turn to our climax section, where our panelists, again, together with our speakers, are going to look at some of the take-home messages that we can leave with. And remember, we do have that last question that I do want to save best for last. Let's go first to Felicita. You've had a quick drink of water. Perhaps we can ask you to invigorate the opening of this final segment, because these thoughts are in my head right now. What are we going to do about all of this, the knowledge that we have today, and some of the discussion points that are circling around the data points? How do we bring about change, shaping more diverse and inclusive global organizations that can deliver better for all people? It's not just about people in one part of the world or the other. And let's pass each of our speakers to a brief round of what comes next in their mind. Because we're running a little short on time, we ask you to keep your answers very crisp, maybe 2 minutes per response, and then we'll move to the next one. Felicita, may we start with you? How do we mobilize the change that we dream of, that we work for? And what's going to work to drive change? Is it going to be policies, measures, demand from non and underrepresented groups, or something we haven't even thought about?
Yeah, thanks, James. It's a great question. I really am also appreciative of the energy in the room virtually, also from the participants in terms of how do we take this forward? What can we do with our advocacy? And I've seen some comments here about, this really helps with our advocacy, and this is really going to be helpful for our advocacy. I also appreciate the fact that over the last couple of years, there really has been a momentum gaining around addressing inequity, inequality, diversity, inclusion issues within the global health sector. And I think this report is really going to help continue that momentum. And I think we each have a responsibility now to take this into each of our individual and collective spaces to continue these conversations. I think we need to move beyond having these conversations, having representation around the table, involving people who are holding the power and people who need more of the power is critical in those conversations. If we really want to address these issues, we also need to have institutions really, and the ones that are named in this report, really use this opportunity to think critically about what this means for their culture, for their work as an institution, and their commitment to really address inequity in global health. I think we can really learn from the social justice sector and the HIV and AIDS movement, the HIV and AIDS response, in terms of how people living with HIV, particularly people with disabilities, also LGBTI people, etc., have had this rallying call of nothing for us without us. And I guess that also speaks to kind of the balance of responsibility in terms of how are we going to dismantle the system, is that there are things that as communities that are affected, as people that are disempowered in the sense who don't have the power. There are things that we can do in terms of becoming more vocal about demanding seats at the table, bringing our own camp chairs, etc. But there are also things that institutions need to take responsibility for, and that they need to be called out for. And I think this thing of this name and shame approach is also useful. And I think Fiona referred to that as well in some of her remarks. Because we really do need to call out institutions that don't truly, live out and enact the values that we have for global health to be really equitable. Let me stop there. I have a few more thoughts, but I think those would be great places to start.
Thanks very much, Felicita. And I think it's not exclusive to HIV and AIDS, but since almost all of us on this panel do come from the AIDS community, when we talk about claiming space for boards, I think that our community has shown that we've claimed our lives, that there was a time and there is a time today when people are demanding to live, and that has to be the most powerful example that I can think of. Fiona, I asked Felicita about how do we mobilize demand for change. May I now ask you what changes are needed from your wide experience in the private sector and not only in health? What has worked to increase diversity, and what role can charter marks and ESG investing play? What lessons are there for the non-profit global health sector that you can gift us here?
One of the things that I'd like to do, and I do in spades, is demystify the role of the board. Being on a board is not difficult. It only does two things: performance, strategy and stargazing; conformance, abiding by the law. And if you haven't had exposure to the boardroom before, you're often not brave enough to apply. So we need to set up a support structure somehow, specific, I think, to the health sector, to inspire people to step up on, as was discussed earlier, a board that you're not even going to be paid for, where you've got all those responsibilities and liabilities, because actually it's fun, it's enjoyable, and it's really valuable to you, the company, and society. So it's setting up a support structure and making it as affordable as possible. We do not want elite structures where only the great and the good get access to that help. So I know we've done it in the UK, and we've done it in Australia, but we need to think about how to widen the net and bring more people in and provide the infrastructure that's necessary to get people and minorities over the line. And they're not minorities, they're part of our society. I should not have used that word.
Thanks very much, Fiona. Can we go now to Asi? Asi, I know a little bit about your life. I'm very privileged too. And I can know no greater champion for people. And I know you're so widely regarded as an elder states figure for health and all that is good in the world, not only in health. Can you give us some closing thoughts about what you see make a difference in the demand for more representative decision-making in global health, but also far beyond global health? What works, Asi, and in which direction do you want us to move morally?
Thank you, James. And again, building on these excellent points, from Felicita and Fiona, the first thing is really to be mindful of all of this right from the start. When we put in place boards and then we talk about membership, we do not think about these things, or take them as an afterthought. Do whatever we have to do. Say, hey, where's the diversity? Where are the women? Where are the people from the global south? So it should be there from the start, and not in the course of it, not at the end. That's one thing. The third thing is that we really need to practice, what we preach. And I think, in principle, we all agree, usually, and it is not very difficult to agree on that. It's very rare to have somebody taking a stand and say, no, we don't want women. No, we don't want people from the global south. In the contrary, I think everybody will easily, say that. But if it comes to translate that into action, each of us, it doesn't matter, where we sit, either if we have to talk about it, or if we have to advocate for it, or if we're a decision maker, then we decide and we act on that. I used to say that global health and HIV are about science, politics, and the activism. And I think we need to bring now the activism, back into that to get that balance right. That balance that we saw, in the chart, what we introduced, it will not, gotten right, if there is no activism that go alongside, the science, alongside, the politics. Because many will be there because of their scientific knowledge, and then they're grounded into that and recognize. Many of them will be there because they're political appointees, which is not necessarily, negative, or bad. But I think there is an expertise out there in activism, in advocacy, in hosting a virus in your own body, in having the problems, that they have to solve. You will have to live them on a daily basis. This is also an expertise, that has to be, recognized and then heard, very loudly. And then if we miss that, we will be, missing the richness, that we would like, to see. And finally, I would say on an individual basis, coming back to practicing what we preach, well, either we take a stand and then say, no, I'm out of here if the diversity, is not, in right from the beginning. It is taking a stand and making it very loud to bring change. Or if we were in a very privileged position, then to be there, to give ourselves, time, and then a deadline by which we would like to see this, change, happening. So if I'm the first and only, I would like to see, in the time that I'm there, that it will no longer be the first and only, and then that will be the more diverse. And then if I cannot achieve that, then I better, take a stand and then leave and then make it, a point. And I think we are seeing now more than that, in many people, and I recognize, many of these community of carers, you're a man and then you're called on a panel and then you see the only man, then you refuse to sit, and not just to be there and say, okay, that is not all right. I think, and those are starting now to bring, change. Trust me, some may see it, as small actions, some may see it as some kind of activism. That's all okay. As long as, that is what is triggering the action, then it is fine. And I think we all have the collective responsibility to do so. And we are there a community, which I call a community of carers. And that, give us, the responsibility as well as, the legitimacy, to move that forward. And the data that we have, the analysis that we get are all good instruments, to do that. So let's push together. Over.
Thanks very much, Asi. Let us save that question that we heard earlier as a trigger for our one final thought. If you could capture this in only a few words. The comment in question again was this, that it is easy to feel powerless in the face of such a massive challenge. And no doubt, I'm sure the people at G8 5050 themselves feel that enormity of a challenge. The question is this, and in a few words, respond to, what can we do at an individual level? Asi, in a few words. I see you on mute.
Act on it. Act on what you preach. Take a stand, and bring change.
Act on what you preach. I think Margaret Chan always says, "Walk the talk. Words are cheap. It's only the action that actually counts." Thanks for that, Asi. Fiona, and then we'll go to Felicita, please.
Pull people up, reach out and search for people not like you. Inclusion is about being consciously inclusive. It's not about unconscious bias. We all have bucket loads of that.
And you can do that in new ways by going to Women on Boards. I've been looking, they're all over on social media, and Fiona as well. So there's no excuse not to reach out and to make that change happen. Felicita, please.
Thank you. James, when I read the question, I thought about this poem that ends with, when I was young, I wanted to change the world. And when I was wise, I realized that I could have changed myself. And it's a beautiful poem that talks about, how do we create change broadly? And I think it's such an important message in terms of really looking at our own biases and how we contribute to these systems, and the role that we individually play in dismantling them. And in our small world, in our small way, where you are, do what you can. I really believe in that. And sometimes it becomes really daunting, and it really, we become cynical. And I think, I'm 4 weeks away from leaving my current position. But I really do think that, we have to use what we can where we are when we can. And that, that is really, for me, how one changes the world. But I think this is also something where we have to come together. If we want to go far, we have to work together. So yeah, those are my reflections on that.
When I was young, I wanted to change the world. When I was
wise, and
wise.
when I became wise, I realized I could only change myself.
Okay, we've got that all in mind. Sarah and Kent, very, very last words, and then I'll wrap up. Just a few words on what the individual can take away. You've created the findings. What do you tell us?
Okay. Thanks, James, and thanks, everyone. Well, first of all, obviously, we just want to get the facts out there and the evidence out there. But as I said, we know it doesn't speak for itself. I think there's a number of things organizations can do, and SC, as SC was saying, and as we saw in the chat from Alvaro, that boards need to be much more deliberative in their design. In terms of whose seats are allocated to whom. I think that should be a big part of the agenda. As Fiona was saying, there are quite a number of things, and we need to be clear about this in global health, and there's much we can learn from you, Fiona, around what are the measures that can be put in place to facilitate access to boards. I think access is important. But my third and final point is really around framing. And framing and pointing out and calling out what's acceptable and unacceptable and making a new normal. And we've talked about the HIV/AIDS response. I want to just remind people that long ago that it was normal to say that there should just be drugs for rich people. And in fact, a number of constituents went out of their way to say, well, the price of these medicines doesn't really matter because Africans can't tell the time anyways. I mean, and this was this trope that was used to deflect attention from actually what shouldn't be. And I think that we need to look at these boards in the same way in terms of the framing of what's acceptable and what isn't acceptable, and who's trying to keep these tropes and these narratives about that the board should be a space for elderly white gentlemen, and that club that was spoken about, that should not be normal. And so same way, I mean, and maybe this is what Asi was getting at, in the same ways that the notion of a manor is no longer acceptable, so no manors, no mords, men only boards, no wards, no white only boards, and no ords, no only old people boards.
Sarah, do you have words to add to that?
Could I possibly try follow on? Just give it one go. Just reflecting on the amazing contributions we've heard from the panelists today, for which I am extremely grateful. But I think what you've done is reminded us that boards are simply a reflection of inequalities and inequities across wider society. And we might have strategies for changing boards. The challenge that we're all face, and that we are all facing, is how we change inequality across society. And I think women have recognized that you don't achieve gender equality inside organizations by changing women. You need to change the organization, and you need to change the society that the organization is based within. So I would just urge people to remember that, but also reflecting back again on what we heard from us in particular, global health has shown that change is possible. You know, we have shown as a sector that change comes about through social movements, whether it's HIV or women's access to their reproductive rights, or you know, or the disability movements. That this has come about not because of the membership of who sits on the board, but because people collectively have demanded their rights, not discretionary gifts and entitlements, but people demanding their rights. And so as a final point, I would just say that what we've done at GH 5050 is hopefully give the data to catalyze change, and that the data is the start, not the end. Thank you.
Well, I will touch on that shortly, Sarah, but I do want to address also what I felt to be the shift in our digital room when we heard that story that you told, Kent, about why people were undeserving to be given access to medicines because they were deemed inferior to. And it reminded me of what Peter Piot said back in the 1990s when they created UNAIDS. He said, whenever people used to see me, political leaders, they'd turn around and run off in the other direction. But come by the 2000s, such was the political transformation and the transformation in political leadership that people then began seeking the people leading the fight at community level and also at high levels of the AIDS response. I think that in alone should give us the greatest hope. Of course, that change didn't happen because of a space of a decade, but because of many people who worked. So allow me to read off 2 comments to bring us to a close here. We're very grateful, of course, to be joined by Dr. Alvaro Bermejo, who is the Director General, as you know, of IPPF. And he says this, and I say it because I think we need to always improve ourselves. So in that spirit, Dr. Bermejo says, I worry that many of the solutions being pointed out are about improving the supply side, better recruiting, helping transitions, etc. Helpful. But I think much of the supply is there and ready. In fact, women and low middle income country staff from most of our global workforce and clients. What is lacking is the demand, the open door, the creating of conditions. We need reform. To seriously reform how global organizations are governed, rather than just improve recruitment and bring diverse groups into a system designed for high-income men. But I'll finish off with this, and I think it goes in deep appreciation, not only to Sarah and Kent, but to all the people who make Global Health 5050 happen, those in the room, behind them over in Cambridge, but right around the world. There they are, wave guys. Andrea Lucas says this, we really appreciate the power this report has had for our work to diversify our organization. Still a work in progress, but this kind of accountability is crucial. So thank you to everyone at GH 5050 for equipping people as they go ahead in their own struggle and our collective struggle. To Fiona Haythorne, to Felicita Hikam, to El Hajasi, to Professor Sarah Hawkes and Professor Kemp Hughes, and to everybody who's watching here today. We thank you for your time and for your attention. This marks the end of our time together, but I encourage you to keep engaging on Twitter and keeping your questions and comments going on there. We'll keep a record of it, but most of all, we'll be learning from them. And allow us all to challenge each other in sharing what we've learned today with an equal number of men and women and everybody. Take care. See you again.
And thank you, James. Thank you.
Thank you, James.
Thank you, Fiona.
James.